to grab Facebook, YouTube, stuff like that. Now we're using web-based stuff, which is a little sketchy.
Thank you so much for joining us, everyone. I'm Treasure Roberts, a reporter here at News 6. This is our Mental Health Day. We've spent weeks preparing for this. How are you doing? That is the theme for today. And I want to go ahead and introduce one of our mental health professionals, Charlotte McCullough. Hi, thank you so much for joining us.
Hi, Treasure. I'm so excited to be here today.
I am excited to have you. I'm sure you have so many things to share with us, and this is just so needed, especially after all that has happened this week, this year, and in the past 2 years. But first, I want you to go ahead and just give us a brief introduction to all the people watching today. Who are you? What do you do? And why do you do it?
Okay, so my name is Charlotte McCullough. As Treasure said, I'm a licensed marriage and family therapist here in the Orlando area, specifically Winter Park. I own a practice, and the name of my practice is Centerpiece Couples and Family Therapy. So, my niche, the things that I specialize in, is with women and with couples around trauma recovery, around depression, anxiety, and all things that has to do with mental health.
Okay. And tell me why you chose to do this in the first place.
So, Treasure, that's a really good question. So, I started my career out in child welfare, working with children who are abused, abandoned, or neglected with the Department of Children and Families. I also did some time with the Department of Corrections and the Department of Juvenile Justice. But over the years, during my experience, I started wondering, why do we see some of these families over and over again, and realized it's not really about connecting them to resources, but these were generational things. These were things that was deeper than just connecting them to resources in the family. And that's when I went back to school for my master's in mental health counseling.
What you're doing is so important, and I'm truly excited for this conversation we're going to have today. I just want you to know there are people who are listening right now, they're sending in questions, so I want us to have a great conversation and also pull in some of these questions from viewers who really want to know from you. But I
Good
do
stuff.
want to, oh, go ahead. What'd you say?
No, I said that's really good stuff, especially after going through what we've gone through in the last few years and over the last couple of hours, what we've all experienced as a community. I'm really happy that WKMG has taken this serious and has really done stories, doing stories today, or just dedicated this entire day around mental health and mental wellness. So I'm looking forward to this chat as well.
Yeah, I do think it's something that we definitely need to talk about more. We need to think about more, no matter what your family background is, what profession you're in. I actually kind of want to start by asking you, do people have to go through something traumatic to seek therapy or to even worry about their mental health?
Well, you don't have to go through anything. To be honest, Treasure, there's this dichotomy, this belief that if I don't have a mental health diagnosis, I am mentally healthy. And that's just not true. You can not have a mental health diagnosis and not be mentally healthy. There are things like anger, things like isolation, things like just irritability, severe irritability and different things like that. So when we talk about mental health, I like to explain it this way to people. Think of mental health as a spectrum, right? We have the lower end of the spectrum and the higher end of the spectrum. The higher end is more where the diagnoses are major depression, schizophrenia, bipolar. The lower end are things around, I don't know what I'm feeling. I have a lot of anger. I'm disconnected. I just don't know what I'm feeling. I'm feeling this out of body experience. I'm isolating. I don't know what it's about. And I just don't feel like myself. I'm not motivated. I don't feel depressed, but I'm just not motivated. So when we think about mental health, I want us to think of it in that way. So that includes all of us.
And a lot of things have just affected us as a people, whether that be here in Orlando, Florida, the United States, across the world in just the past 3 years. Of the things that you can think about, what are some of the things that you think could affect the everyday person?
So the one of the main things that can really affect us is seeing things that has happened. It doesn't necessarily that it has to had to happen in our household or at our jobs, but just witnessing the violence that we've all witnessed. And then during the time, the high peak of COVID, witnessing so many people losing loved ones, and that resonating with us losing loved ones, So those things can affect us. It doesn't mean these things happen to you specifically, but witnessing these things can also affect you.
And I'm glad you brought up COVID 19. I mean, that was such a huge thing for everybody, something that a lot of people had never been through before. And it wasn't just that there was a virus circulating. It's all the things that came after COVID-19. People staying in their homes may have become depressed, or maybe they lost jobs, and all those things that
Absolutely.
it's just like a ripple effect after the fact. People are still
Yes.
struggling after COVID, even though people
Yes.
might not be wearing their masks anymore. you know, what are some of the things
But
that you've heard from families when it comes to the aftermath of COVID 19?
Treasure, I think we're all struggling now to get back to what we call normalcy. We still don't know what that is at this time. And the uncertainty, I think that is what really caused most of us to be in this place of panic, this place of shock, and this place of just isolation, because we really didn't know what to do to protect ourselves, and it was like it was popping up everywhere. Don't do this, don't do that, wear your mask, don't wear your mask, stay 6 feet, stay in the house. So
Mm-hmm.
all of that, and it came out of nowhere. Think about that. It came out of nowhere. So most of us are still living in that place now of uncertainty. Like, is it coming back? I mean, what else is going to happen? In addition to all of the other things that we're experiencing worldwide as well as in our own homes.
Exactly. And during that time, in the heat of COVID 2020, and moving forward, even now, would you say that you got a
Yes.
lot of people coming to you in search of mental health help?
Listen, my intake went up about 40% during 2020, 2021, with couples specifically and families as well as individuals. But my couples appointments went up significantly because you had couples who really was in a place where they survived by being in different places for a long period of time during the day. But when the shutdown happened, everyone was forced to be in the same space indefinitely, and that caused a lot of issues as well. So we saw divorce go up. We saw a lot of abuse go up, physical and mental, emotional, as well as child abuse. All of those things increased during that time.
So, would you say that COVID 19 almost uncovered issues that were already there?
I think it uncovered as well as created some issues. And the other thing, when I think about COVID, I think about it forced people to really face their mental health challenges. It forced people to get help. It forced people to face, like, this isn't a work issue. This isn't a family issue. This is a self issue.
So I do want to pop in, should I say, some questions from viewers every now and then. Here's one from Sylvia. She says, "Do any mental health issues qualify for Social Security?"
Well, it depends on what that mental health diagnosis is and the severity of it. I would suggest that she gets evaluated or have an assessment done by her primary doctor, or if she has a therapist, if she can be evaluated by them, start there and then go through that process. But I'm sure that once she get evaluated, the provider that she uses can guide her to that place of where she can get further answers.
Okay. And for those who are watching, and we still have more questions, but we want you to engage with us. We have a live stream on YouTube, WKMG News 6 on YouTube. You can also go to clickorlando.com/mental health. Drop in your questions. We really do want to hear from you, and we want you to get the help that you need. Here's another question
Absolutely.
from Sal. It says, "How do you get help if you don't drive anymore?" And they do have a follow-up question, so I'll give you that one after the fact.
Okay. And that's a really good question, Treasure. We have a community resource right here in Orlando, the Orlando area, which is called the Outlook Clinic. And the phone number to the Outlook Clinic is 407-898-0110. They can call and have an assessment done and all those things. And they do offer virtual sessions. So there is help.
And honestly, virtual sessions, is that something that became a bit bigger after COVID 19? A lot of people were doing virtual therapy
Absolutely.
sessions.
Yes, because people were taking their mental health seriously, and a lot of people who were in therapy didn't want to miss their appointments. So that is one way that we can still get help to people. And some people, to be honest, Treasure, some people prefer virtual sessions than in office sessions. But if you are a person that's on the go, or if you're a person that don't drive or don't have transportation, I think that the virtual option is a very good option to take care of yourself.
Okay. And do you think, though, that there's any difference, though, from actually being in the room with the therapist versus being online? Is it better? Are they the same?
So I get that question a lot. It depends on the person because, like I was saying earlier, some people prefer virtual over in person. So it's a person by person preference.
Okay.
Some people get really good results in office, some people get really good results virtually. So it just depends on the person.
Okay.
And I
Thank
would
you.
suggest try both just to find out which one
Yeah,
you
see which one
prefer.
you like. Yeah,
Yes,
shop around. Definitely want to talk to you
absolutely.
about shopping for a therapist. But everybody watching, I also want you to know we do have a phone bank. The Mental Health Association of Central Florida is here with us today. They are answering your phone calls, answering your questions, and trying to help you find that support that you need. So please, please, please pick up the phone, give them a call. You can see the phone number is right there on your screen, 888 436 6665. Please give us a call. And then I want to get back to that viewer question. They did have a second question, non related,
Okay.
but they did say, is there a cure for PTSD?
So when we talk about cures, usually we're thinking about give me something so that I can get rid of this, so that it doesn't bother me anymore, so that I don't have to face it anymore, so I don't have to think about it anymore or experience it in my body. When it comes to mental health, I want you to think about there are a number of diagnoses, just like on the physical health side, there are no diagnosis, there are no cures. But when there is no cure for a diagnosis, the first thing we go to is management. So think of something like high blood pressure, right? There is no cure for high blood pressure, but what do our doctors do to help us manage it? They give us medication, they tell us to exercise, change our diet, and different things like that. So when we think about PTSD, you're not cured, the main focus is management, getting a real plan and strategies and interventions so that you can manage it properly.
And that's actually really important. I feel like a lot of times people may want a quick fix for things,
Yeah,
but tell us about how
absolutely.
therapy is work. It takes time.
So when we experience trauma, right? We experience trauma. That's an experience that we've had that changed our view of ourself, of our world, of our religion, all those things. It's shock in our bodies. It changes our perception of things, how we connect, how we feel. It changes our sense of security and how we want to be around people if we don't want to be around people, right? So when we think about trauma, trauma does not self heal, it has to be treated. So most often people think when something happens to me, over time it'll just get better, and it'll just go away. But not with trauma. It shows up in different ways in our bodies. It can show up in our physical health. It can show up, on our skin. It can show up in our talk, the way we treat people, the way we treat ourselves. So it shows up in a number of ways.
And I don't know if you've ever heard this phrase, and correct me if I'm saying it wrong, but to get over something, they say the best way is to go through it instead of going around it, right?
Yeah, yeah, I think I
Exactly.
like that, Treasure. I like that. So when you think about mental health and you think about therapy and you're saying going through it, it's really facing it. How do we really get through these things? By facing it, by admitting that I need help. When we feel that feeling of being stuck, or if we've had an experience and it continues to come in our present, it happened back here, but it continues to come here, or we notice patterns that are happening in our lives, those are indicators that it's time to reach out for some help, to learn some coping skills, some strategies, and some different ways of handling these things. Anytime we experience something, Treasure, that shocks us, we're going to be triggered by that. Everybody is going to have triggers. All of us have triggers. It's emotional response to something that happened in the past. All of us have triggers. But the goal is to recognize what those triggers are and what do I do when I feel this in my body, when I'm thinking like this, what is my go-to step? And that's what we help you do in therapy. We help you identify those triggers, then we help you get interventions and strategies of how to live your life in a healthy way with these things. I often hear people say things like, I don't want to get triggered no more. I don't want this to trigger me. I don't want this to bother me. Well, the human experience, we're going to have triggers. You can get over one trigger and then there's going to be something else that happens. So the goal is, how do I manage this? How do I recognize this is what I'm feeling in this moment? And then what do I do next?
And I'm glad you mentioned triggers and you said exactly what I was going to say. I'm triggered. That's triggering. Those are some of the common things that people are saying now. But for the people who don't know exactly what it means to be triggered or what
Yeah.
is a trigger, can you explain that?
Yeah. So a trigger usually is an emotional response to something that happened to you in the past, something that you experienced in the past that was traumatic or that was shocking or caused you to freeze, flight, or fawn. And so whenever you experience something that's similar to that, it can be a smell, it can be an environment, it can be a person, it can be a person's statue, it can be the way a person smile. Whatever it is specific to you and what happened to you, but it causes you to feel that same feeling that you felt initially when this thing happened.
You can
And
be.
so think about that, Treasure. When someone feels that, that is real. You can't tell somebody that, oh, that's not real. You're okay. You're not in that situation now. But our response system, right? Our nervous system, our amygdala, it is there to protect us. So what are you going to do? Turn it off?
How can
So when
people.
a real thing happens
Right.
and it's turned off, what are you going to do?
Exactly. How can people be sensitive to people in this situation, if they feel triggered instead of making them feel like that's not real? How can you be
Yeah.
sensitive to somebody who's dealing with that? Because a lot of times, depending on your household or your background, they might say, yeah, go drink some Vernors and you'll be okay. Just go take a nap. You'll be okay. Wake up tomorrow,
Yes.
try it again. Is that insensitive?
Yes. I think that's insensitive. And I think that's why it's so important to have these talks that we're having so we can bring these things to people's consciousness so that they can be kind, so that they can actively listen and understand that that may be a traumatic experience that this person had or a trauma response when they're saying, I'm triggered or I'm scared. But being able to tolerate that difference and being able to accept that from that person. So just being able to show empathy,
Okay.
showing that that is
Empathy.
something that's very important to someone else. You may not understand it, but having the ability to understand, like, this is important to them. I don't understand it. I didn't experience it, but I'm going to, be understanding and listen.
That's good. That's good. Thank you for sharing
Hmm.
that. We're going to get
Of
another
course.
question from viewers. I do hope the viewers are watching. This question was anonymous. It says,
Okay.
can you help educate the public about NSSI? NSSI, for those watching, is non suicidal self injury. Can you tell us a little bit more
So,
about that?
yeah, I mean, I think a lot of people think about that. And it's not, when we say NSSI, it's basically talking about people who are cutters. So they usually are people that have high anxiety or a lot of emotional pain. And the way that they get relief is by cutting themselves and seeing that blood. And that's when they get relief or they get a sense of calming around that. And that's one of the things. If someone is a cutter, I would definitely suggest that they do get into a therapist or a psychiatrist and get some help to be evaluated, assessed, and get some strategies and some different things to help them deal with that stress and find out, like, there are different ways to relieve that emotional pain. So when we call it non-suicidal injuries, so it's not, the intent is not to kill themselves, the intent is not to harm themselves, the intent behind it is to get relief in the moment. But they can cut so deep that it can cause injuries or it can cause fatalities.
Wow.
Absolutely.
Do you
Hmm.
think that it could be the beginning of the next step of actually thinking about taking their life?
It could be, depending on how severe it is. Absolutely, it can be. Absolutely. Yes. And it's serious. Anytime someone harms themselves to that degree so that they get relief, it's time to really reach out for professional help. That's not something that we take lightly or just say they'll get help, it'll get better, they'll stop, they'll keep doing it and they'll see they're hurting themselves. But it's just like us. If we're having arm pain, or if we're having a headache, most of us go straight to Advil or we go straight to Tylenol. So those people who are challenged with that, the first thing that they go to for relief is to cut, which is very serious.
Yeah.
Very serious.
And if anybody watching is dealing with that, you ask this question because that's something you've done before. These people are here to help you. They want to listen to you. They want to answer your questions. They want to find support for you. So please, please call into our phone bank. The Mental Health Association of Central Florida, again, is here. They are answering the phones. They are busy. You can see them working. This is the phone number on your screen, 888-436-6665. Please call in. And I do have another question for you, Charlotte. This
Okay, and
is
one thing, Treasure. So, if, for instance, if someone finds later this week or later next week or this weekend that they want to reach out for help and they don't have this number and this number isn't available, they can always reach out to the Outlook Clinic with the Mental Health Association. And that phone number is 407-898-0110.
perfect. Thank you for adding that. I hope you are listening and jotting those numbers down in case they missed it. Can you give us that number one more time?
Yes, it's 407-898-0110.
Okay, perfect. Thank you so much. We actually have a question from the phone bank. They say, how do I access services and where do I start? That's a great question because a lot of people just don't know where to start.
Well, Trisha, I think this is a really good question too, because they're open to help. That's the first step, being open. So asking this question, this is amazing. So they can call the phone bank or they can call that number that I mentioned earlier, 407-898-0110. And we have people there on the phone that will lead you through those steps. Even if you have insurance and you don't know what to do with your insurance, we have people on the phones that will walk you through that process.
You just segue to the next question from the phone bank, which was, how do I pay? What if I don't have insurance? What a great question.
Yes.
Mental health help, therapy, super important. Also, can be super expensive.
Yes.
How can people work around this? What can they do?
So here in the Orlando area, the Mental Health Association has this clinic that I talked about, the Outlook Clinic, that offers free psychiatric and counseling services to our community. So you can reach out to them, that same phone number, and they will get you scheduled. They will assess you. They will get you scheduled, and you'll have your appointment.
Wow,
Counseling
free.
services, or it's free. It's
Uh-huh.
absolutely free. When you do call, they're going to do an intake process. So be prepared for that. They're going to ask you some questions, and from there, they'll schedule you for your appointment.
That's so important, because
Yes.
sometimes you see therapy sessions online, whether, I won't name names, but just some of the
Yeah.
therapy companies online, it might be $80 per session. Then it's
Yeah.
like people are like, well, I want to get help.
Can't afford it.
I can't afford to pay for that. And,
Absolutely.
and so even if they don't decide to go to this program that you had mentioned, is
Yes.
there any other way around it? Are online therapy sessions, virtual therapy sessions cheaper than those that are in person? Should they seek therapy at their religious organizations? What should they do?
So when you're looking for a therapist, you want to keep in mind your budget, what you can afford. And there are a number of free resources here in our area. The Outlook Clinic is one. There's another one, an agency here called 26 Health. And you can find them online. They also offer free behavioral services as well. So when you're looking for a therapist, you want to think about your budget. What can you afford? If you are if you're a person that drives, what area are you looking for a therapist in? If you're a person that does not drive, so you'll be looking for a therapist that offer virtual sessions. And if you're a person that want hybrid, sometimes you want to go in, sometimes you want to stay at home or just appear virtually. You're gonna look for a therapist that offers both of those. Also, you're going to want to reach out to the therapist and possibly do a consult. So, asking them questions around what are their fees, what's their educational background, what are their specialties, why do they do this work, what is their cancellation policy, what is their termination policy. And you just want to get a feel of who they are and what they offer and just have a real conversation with them and go by what your gut is telling you about that person. Do you connect with them? And
Right.
is it someone you can feel safe with?
Yeah, shopping for a therapist is super important. When you think of shopping, say you're online shopping on a website, they have filters. You choose the price point, you choose the color, you choose the fit, because they have to fit right. So you
Absolutely.
can look
It
good.
has to fit right. Exactly. That's important. Right.
Exactly,
Same thing with your
exactly.
therapist. You want one that really is tailored to your needs. You want someone the tone of their voice, how they look, their
Mm-hmm.
nationality, their beliefs. You can
Mm-hmm.
ask your therapist, what are their beliefs, all those things. I have a number of clients that come to me after seeking spiritual counseling, and I have had some people say to me that their spiritual counseling and their mental health counseling, it's kind of different. So for some issues, they'll go to spiritual counseling, and then for some issues, they'll come to mental health counseling. But it's totally up to you. But when you're thinking about going to therapy, I would say definitely shop. I would say definitely talk to the
Mm-hmm.
therapist and find out as much as you can about them. And no question is a dumb question. If
Mm-hmm.
you reach out to a therapist and they refuse to answer a question, that's your answer. If
Mm-hmm.
that's your therapist.
Yes, exactly. And bringing it back to the shopping online, because I have a follow-up question to that. Say you're online, you chose the filters that you want for your specific piece of clothing. You're so excited for it. The clothing comes to your house, and you try it on, and it just doesn't seem like the right fit. The first red flag might be that you can't zip the pants up, you can't button the
Right?
shirt up. Red flags. Maybe you should send that shirt
Yes,
back. What are the red
absolutely.
flags for therapists? If you get to your therapist's office, what what should you pay attention to? What could be a red flag that should tell you, hey, maybe I should shop for somebody else?
Yeah, so one, timeliness, if they're on time. Another one, if prices change really quick or the price change and you don't know what happened. Another red flag, the paperwork, the intake process, if that's not clear and it's all over the place and you feel uncertain about that, that's a red flag. Another one is the environment. When you get there to the appointment, if you feel the environment is not safe or it's not one where you feel like it's a trusted environment, that's a red flag as well. And if you're in the session and your therapist is one that talks about themselves more than they talk about you, or don't listen much to you and telling you, giving you directives, start out giving you directives, that's a red flag.
Okay, and they should take these seriously, correct, and move on and find
Absolutely.
somebody else because your
You can
mind is at
end.
stake. Mm-hmm.
Absolutely. You definitely can end. You can terminate your services with a therapist at any time when it's not working for you. You're not obligated to stay to one therapist. The thing to keep in mind is you need a therapist that works with you, work
Mm-hmm.
collaboratively with you around the issues that you bring to
Mm-hmm.
them that you want help with.
Okay. And staying on the
Hmm.
topic of red flags, we actually have one last question from the phone bank. It says, what are red flags for loved ones and children? And I believe they mean in terms of when
Mental health
should.
or when they need
Mm,
help.
exactly.
Yeah.
Exactly.
And that's a really good question. And children, I would start with that one. Some of the red flags for children is if you start seeing behavior changes, shifts in their behaviors, how they're responding to you, how they're responding to their teachers. If they started wetting the bed, if they have lack of motivation, if they're scared to go to school, if they're having a difference in their sleeping patterns, those are some indicators as well. And I would say reach out to your
Mm-hmm.
children and talk to them. Have a regular conversation with them about what they're feeling
Mm-hmm.
in their bodies or if anything has changed for them versus accusing them of just being bad or just being disobedient or
Mm-hmm.
rebellious, but having that conversation and really getting into their world.
Mm-hmm. Is it possible that those loved ones and those children actually suffer because their families don't believe in mental health? They don't believe in therapy. They may say, go to your God source or
Hmm.
just do something else. Do they suffer from that?
Absolutely. Absolutely. We have a number of families that do not believe in mental health counseling, but we still have family members that have some mental health concerns or possibly mental health diagnoses. And those children, like I said, you'll see those behavior shifts and different changes in those children. But when we say we're not open to mental health counseling, I want to normalize this by saying this, Treasure, that just like we care for our physical bodies and it's very important, it's the same thing for our minds. And we want to move away from just because we can't hold our minds in our hands, but if something happens to our arm, we can feel it. We
Mm-hmm.
still need to give it that much attention.
Right.
When you do see behavior shifts, when you do see someone having severe irritability, anger issues, crying a lot, or suicidal ideations, I just don't want to be here anymore, or someone who's very suicidal saying, I want to die and I have a plan, those are all indicators that we need to get a professional involved. And it's okay talking to someone. And I know a lot of people feel like, I don't want to go tell this person my business, but it's not telling your business. It's getting treatment for where you are at this moment. You're talking to someone who's educated, who's trained to listen, totally different, to treat, to diagnose, to assess, and help you through this crisis
And
or just situation that you're going through.
yeah, I hear that one a lot where they say, I don't feel comfortable going to talk to a stranger about my business. But then at the same time, they don't talk to anybody. So, it's like they're almost holding it in.
Right.
Lastly, and my last question for you, this has been great. Why is there such a negative stigma around mental health help and therapy?
Well, one, like we mentioned, it's hard for people to be vulnerable around their weaknesses. It carries a lot of shame with it because people have to open up about what's really going on with them. Another one is some people have the mentality that when we talk about mental health, we're talking about people who are insane, or people who are having a psychotic break, or somebody is just going crazy. And some of us grew up in areas where we've seen people who walk around talking to themselves, or people who just, don't bathe every day or wear the same clothes. So we have the mentality of that's what mental illness is, or those are the people that need to go and get help. Not me. I don't look like that. I'm not acting like that. So it has that, negative tone to it around embarrassment, around this is just bad. I'm ashamed of this. And like I said earlier, when we talk about mental health, Treasure, we look at it on the spectrum, right? There are those severe diagnoses that's really real, but then we have those things on the lower end around, like we're saying now, just I'm not feeling well. I'm a person that likes to cut. That may not be a diagnosis, but that's how I get the need met. That's how I get relief. That's a mental health concern. It may not be a diagnosis, but that's a concern. That's an indicator that it's time to get professional help.
This has been so insightful. Thank you so much, Charlotte. Like, I always feel like there's just not enough time to talk about this. There's
Yes.
so many facets of mental
Questions.
health, so many questions, so many thoughts,
Yes.
so many ways this conversation could have gone. But I think you have really helped
Yes.
the people who tuned in today. Thank you to everybody who had the courage to send in a question, whether that was with your name or anonymously. I really do hope that you
Thank
learned
you.
from this today. And I do want to remind people that this phone bank is going to be going all day until 11:30 tonight. Please, please call in. Please go to clickorlando.com/mental health to add your questions. And we will have another live web chat at 8 p.m. I hope to see you all there. This was so helpful. Thank you so much, Charlotte.
Thank you, Treasure.
Do you think we got a lot accomplished here?
We got a lot accomplished. We talked about a lot. We packed in a lot in this little time.
We sure did. There could have been more,
Yes.
but we did what we could do, and I really
Yes.
appreciate you.
I
And
enjoyed
that's-
it.
Yes, that's the number at the bottom of the screen, everyone, again, for that phone bank. If we could pull that number back, it's actually 888-436-6665. Again, that's 888-436-6665. They are working hard in there. They are taking your calls. Please call in. And for everybody watching, please tune in to News 6 at 4 for more of our mental health coverage. Tune in at 8 here live on clickorlando.com/mental health for our next live web chat. And thank you again, Charlotte.
Thank you. Bye, everyone. Have a good
Bye.
weekend.